Dr. Kourakin, I want to talk to you about something which is kind of dear to me, and I really want to shed some light on it. When people have a gum disease, a periodontal disease, a heavy gingivitis, I guess it's more anyway, the gums are infected and inflamed and bleeding and whatever, to whatever degree they are. What we hear from dentists is you will be losing your teeth. And that's a bad thing. You've talked a lot about how bad that is. But at the very least, you dentists at the same token are extremely good in replacing teeth. Implants, implant dentures, crowns and bridges, name it. You are good. We're not anymore talking the George Washington time, which apparently the guy had a wooden tooth in it. I don't know if it's true, but it must have been awful to have a wooden tooth in it, right? So,
yes, many wooden teeth.
Yeah, he did?
Yes.
All right. So in any case, we're not in that time anymore. You're doing a good job. But what I look at it, just from, looking at overall bodies, when a person has an infection, he has an infection. Infections are not a good thing. They're inflammations. It wouldn't matter where they occur. Now, an infection in the mouth, the gateway of the blood vessels, where it drips in it, goes a foot to the heart, a foot to the brain, gets mixed up, that yellow, reddish, ugly pus. It gets all mixed up with food. It goes in the stomach and travels from there, and of course goes into the blood vessels, and thus apparently kidney disease, liver disease, diabetes, lowered immune system, which some Japanese people say, universities say that could make you having AIDS when you have the HIV virus. Now, grant you, not everybody has HIV virus, thanks God, but if it does something so bad, premature born babies, underweight babies, if it does this type of bad thing, that stuff is almost irreparable. Wouldn't that be a lot worse than losing your teeth?
Well, absolutely, it's a lot worse than losing your teeth. And you just left out one thing, Helmut. You mentioned a number of different diseases. Heart disease. When the pus from your gums and your jawbone circulates through your body, it's going to settle in several places. Specifically, any kind of a bad heart valve, it's going to land there. And if you have had any sort of a joint replacement, a hip replacement, or a knee replacement, shoulder replacement, it's going to attack that area there. For instance, for a patient to get clearance to have a heart valve replaced, or a hip replaced, or a knee replaced, they first have to go to the dentist to get clearance from the dentist that their mouth is clear and free of infection before the surgeon will actually do the surgery. Because we know that you can actually ruin the surgery.
Right, and that's relatively new. I mean, I'm not saying 1 month old, but it's in the last decade or so that surgeons more and more become aware that whether they take out appendix or whether they do a knee replacement, they say, look, except maybe a surgery when you have a bullet in your chest and you go to the emergency room, then they maybe don't have that requirement. But rather than that, they have this requirement because this yellow reddish pus kind of can ruin that surgery or has put the body at such a low immune system already. And that's new. That should be a really good indicator to patients to fix their gum disease. Let me ask you a question. You said that you had a whole bunch of patients who are 80 years old. You have this octane type of club, and 100 years you mentioned and stuff like that. And do you see some correlation? It may not be scientific, it may just be anecdotal, but if it is, do you personally feel that people who actually have healthy gums, and by doing so most likely also have most of their teeth or to a certain degree, that there is something with their overall healthiness, not only living long, because medicine can keep us alive quite a bit these days, but it's not about a longer life, it's about adding life to your time. You know what I mean? It's kind of,
yes.
Do you see some correlation there? People who are healthy mouth overall being more healthy.
I absolutely do, Helmut. And there are some patients who are in their 80s and 90s who are absolutely role models for myself. They take care of their mouth. They take care of their bodies. So it's a matter of learning maintenance of the shell that we live in. You know, this is a temple that we live in. We only have one shell that we live in, and we need to maintain that. And if you can maintain this, generally you'll have the wherewithal and the mindset to maintain the rest of the body. Look at some of these people. They eat well. They're socially active there. They don't have to worry about their teeth falling out. They have no problems at all in chewing various foods there. They're happy individuals. They're healthy individuals there. And I see that every single day. And that's why I developed the Octogenarian Club, so that we can show people these are the role models. We need to look at these people and emulate them, because this is the way that we should be going to help ourselves in our own future.
So in your opinion, definitely a common denominator about healthy mouth, healthy body.
Healthy mouth, healthy body, totally, Helmut. You cannot separate the two.
You know, it's amazing, and I don't know whether it's really true, but I heard that when people have a relatively full-blown gum disease, that their infected area in their mouth is as big as their hand. And yet, let's just assume you, me, or anybody we know, when they have like a quarter of a, small little area of skin disease on their hand or somewhere in their body, they will go to a dermatologist, as they should. But,
as they should.
Yeah. But they don't do it with that much of a disease in the mouth.
And I see this too many times, and we try to educate the population. We try to get them to understand that it's not gum disease. And unfortunately, gum disease does not really address the problem. It's bone disease, because it is an infection of the bone. The gums are just the covering to the bone here. That's what we might see as bleeding. But the infection is down under the gum line, and it's sitting on the bone, and it's actually eating away our jawbone. It's eating away the top of the skull, or the base of the skull, and the lower jaw. And it's bone disease, and I think that needs to be changed. I think society has labeled it too simply by saying gum disease. Bone disease, I think, would more accurately reflect the problem, and then perhaps people would understand that treatment is absolutely imperative. And we have cameras that we will show people how bad this infection is. We will probe them, and we will show them, with a probe, the different degrees of infections they have. We have literature that we will present to them, and we try to impress upon them how serious it is and how much of an impact it has on their heart, their liver, their kidneys, their lungs, their entire medical system.
And it has that impact now, not 6, 7, 10 years later, when they will be losing their teeth, which is a whole different animal by itself.
So much damage is done by then.
But that damage is done. That damage, we all know that, fixing the liver, the kidney, the stomach, ulcers, blood, high cholesterol, diabetes, all that stuff is so much more difficult to fix.
Absolutely.
Than, mechanically putting an implant in it.
Absolutely. And it's a shame that people don't realize that the damage that is done at an early point, if it was caught early, is so easily corrected. And if you wait that much longer, then to correct the damage occurring in the mouth does become laborious and can be expensive there. But then you still need to do it, because if you don't correct the damage in the mouth, are you going to correct the heart? Are you going to correct the kidneys? Then it just escalates and things just go out of sync.
Right. And as you said before, with migraines and stuff, very few doctors look at migraine as coming from here. So people have heart disease, they have kidney, and then they go and look and take some kidney medicine, whatever the heck that might be, and etc. And sometimes needed. I'm not saying it's never needed. It's just the cause, the source. Where is the source coming from? Oh, there's a chronic infection which goes on, and it's just like a little infusion dripping yellow, reddish, ugly pus into your blood. Well, I think the biggest mistake is that we do not realize how the body is connected, and thus, too much segregate and say, oh, mouth is mouth. I fix it down the road. I make my mouth good looking down the road. I do an implant down the road. I will, after all, make more money down the road. I don't know if people are anything like me. Usually that doesn't quite happen. And, but the point is, fix it now because you're ruining your body. Very enlightening, very wonderful, your analogies. And I hope people listen to you. Thank you very much, Dr. Kourakin.